Mood disorders. Introduction. Mood disorders represent a significant category of mental health conditions that affect millions of individuals globally. Among these disorders, depression stands out as the classical mood disorder, with a profound impact on individuals and society at large. This video aims to provide an educational exploration of mood disorders, focusing on the recognition of depression, its prevalence, diagnostic criteria, clinical specifiers, differentiation from other disorders, pathophysiological models, psychiatric approaches, and the critical consideration of biological, psychological, and social factors. Recognizing depression as the classical mood disorder. Depression, characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in daily activities, is the quintessential mood disorder. Its prevalence is substantial, affecting people of all ages, genders, and backgrounds. According to the World Health Organization, over 264 million people suffer from depression globally, making it a leading cause of disability. Diagnostic criteria for major depression. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, outlines the criteria for diagnosing major depressive disorder, MDD. These criteria include the presence of 5 or more specific symptoms over a 2-week period, including depressed mood, diminished interest or pleasure, changes in weight or appetite, sleep disturbances, psychomotor agitation or retardation, fatigue, feelings of worthlessness or guilt, diminished ability to concentrate, and recurrent thoughts of death or suicide. Clinical scenario and diagnosing MDD with specifiers. In a clinical scenario, diagnosing MDD involves recognizing various specifiers such as depression with psychotic features, peripartum onset, seasonal depression, atypical depression, and melancholic depression. Additionally, persistent depressive disorder, adjustment disorder, and bereavement must be considered in the differential diagnosis. Differentiating substance-induced mood disorder and primary depression. Distinguishing between substance-induced mood disorders and primary depression is crucial. A careful assessment of substance use history and withdrawal symptoms is necessary to establish the connection between mood symptoms and substance abuse. Distinguishing major depression and bipolar disorder. While depression is a central component of bipolar disorder, distinguishing between the two is essential. Mania, characterized by elevated mood, increased energy, and impulsivity, is a hallmark feature of bipolar disorder. Differentiating between unipolar depression and bipolar disorder is crucial for appropriate treatment planning. Criteria for bipolar I and bipolar II disorder. Bipolar I disorder involves at least one manic episode, often accompanied by depressive episodes, while bipolar II disorder is characterized by hypomanic episodes and major depressive episodes. Understanding these distinctions is vital for accurate diagnosis and treatment. Pathophysiological models of mood disorders. Various models, including the monoamine hypothesis, neuroplasticity, and the hypothalamic pituitary adrenal (HPA) axis dysregulation, provide insights into the pathophysiology of mood disorders. These models highlight the complex interplay of genetic, neurobiological, and environmental factors. Overview of psychiatry and management of depression. Psychiatric practice encompasses a multidimensional approach involving pharmacotherapy, psychotherapy, and psychosocial interventions. Collaborative care, involving healthcare professionals from various disciplines, is crucial for comprehensive patient management. Biological, psychological, and social framework for depression. The biopsychosocial model acknowledges the interplay of biological, psychological, and social factors in the development and perpetuation of depression. A holistic approach that considers genetic predisposition, brain chemistry, cognitive processes, and social determinants enhances treatment efficacy. Prevalence of suicide and identifying warning signs. Depression is a major risk factor for suicide, emphasizing the importance of recognizing warning signs such as changes in behavior, mood, and social withdrawal. Understanding risk factors, including previous suicide attempts, family history, and access to lethal means, is essential for suicide prevention. Conclusion. In conclusion, mood disorders, particularly depression, significantly impact individuals and society. Understanding the diagnostic criteria, clinical specifiers, differentiation from other disorders, pathophysiological models, and comprehensive management approaches is crucial in addressing the complexities of mood disorders. A holistic framework that considers biological, psychological, and social factors is imperative for providing effective care and preventing adverse outcomes, such as suicide. As the field of psychiatry continues to evolve, ongoing research and education are vital for improving our understanding and management of mood disorders.